Okay, today we're going to start with Chapter 1, Introduction to Emergency Services, Occupational Safety and Health. Now with all chapters, you should read the chapter first and then review the PowerPoint prior to taking the quiz. The learning objectives for Chapter 1: discuss the history of occupational safety and health in the fire industry, discuss the history of emergency services safety and health programs, identify by using historical data the safety and health program as it is today, describe the efforts that have been made to address the safety and health problem amongst emergency services occupations, describe the 16 life safety initiatives, list the national agencies that produce annual injury and fatality reports for emergency services, and identify the information that can be obtained from annual injury and fatality reports. So as an introduction, firefighting has always been a dangerous profession, has always had a high rate of acute and chronic injuries and deaths. Firefighters have always been exposed to a wide range of hazards, and this has increased with time as we get more hazardous materials and other chemicals that weren't present in the past times. Emergency medical service responders face many of the same hazards as firefighters, and in today's time, most fire departments, their emergency medical services are part of the fire department. They do both tasks. There's always been a high injury death rate, like I said earlier, for firefighters, and in previous time it was just considered part of the occupation, and people just assume, well, you're a firefighter and there's a high rate. We've changed that probably starting about in the 80s, maybe the 70s, and as we go on in each decade we start changing these things. It's increased that firefighter safety is now a priority. And I've thrown this picture in here because I was on a wildland fire probably 6 years ago now, and as I drove by you can see the fire shelters where firefighters from the department had to deploy their shelters as they were overrun by fire. Back in 1973 there was a document that was published that was called America Burning, and when I took my fire science classes back in the late 70s, this was a required reading for all of us. And this was the first document that focused on firefighter safety, and it focused on this from a perspective of increased staffing, having firefighters trained more, we call it education, but also train more, and providing them better equipment. And again, this is the first publicized document referring to firefighter safety. Your text says in the 1980s that there was a significant increase in interest in the safety problem for firefighters, and the trend is continuing to the 21st century. I'm not sure I agree with that, because being a firefighter in the 80s, safety still was not a priority. At that time, I wore monocrylic pants, which monocrylic pants, if you got them too hot, then they would melt. And we had that happen several times. It wasn't required that you had turnout pants on at all time, or bunker pants as some people call them. Hoods for firefighters was not even thought of at that time. So, I don't know if I agree with this. I can agree that maybe there was more interest in it, but we didn't start addressing the safety, I don't believe, until the 2000s. Now, NFPA 1500 was a controversial document, and that's the standard on fire department occupational safety and health program. And pretty much in there, everything there is based on safety and health for the firefighters. A couple problems with that. As your text says, that emergency services were traditional. We always do things the same way. We always accept that firefighters die, and we're elected to make and accept change. Part of that change, it was twofold. There was one part of the firefighters that said, no, I'm not going to wear a breathing apparatus at all times. I'm not going to wear hoods. Hoods for firefighters was the most controversial thing of the time, where nowadays a firefighter wouldn't think about not having their hood on. And the other part was departments. To increase safety equipment, that increased budgets. And budgets are always a problem still to this day. So it was both sides. And I think safety is now a forefront of all of us. I think we all believe that safety should be the first thing. Some of the changes that since NFPA 1500 came about. Several departments now have a health and safety officer. Your larger departments even have a medical doctor that's responsible for that. There's more books on the subject. Most fire departments now have a safety and health committee, and they usually have a representative from one person in each rank. So there'd be a firefighter, engineer, captain, battalion chief, and even in my department, the Pasadena Fire Department, we had somebody that was from our non-sworn staff, because there's also issues. There's issues that with ergonomics that may not even apply to just firefighters, but may have to your office and support staff. We start developing SOPs or SOGs, standard operating procedures, standard operating guidelines. And the only difference between those two is that some people think that a procedure is a policy and a guideline is just what it says is a guideline. But again, that's all in the terminology. Incident management systems have come about. We start using ICS for everything. And if you're in a fire department or around a fire department that doesn't use ICS, then you got to figure they're at least 30 years behind the times. Our personal protective equipment is far superior than it was back when I came on the fire department in 1980. Back then, if you had a hole in your turnout code, okay, that's okay. We never washed them because that was a status symbol. So nowadays you're required to wash them, you're required to have them inspected, and they're required to meet NFPA. And most departments now have a fitness and wellness program, because we've found is that fitter firefighters, they get injured a lot less, and they also can survive longer, especially after they even retire. And this includes eating better, and again, typically most fire departments have a workout period during their day because we want our firefighters to be in good shape. You have to design your program for your fire department. Now that doesn't mean that you can say, well, we don't go to fires very often, so we don't have to have the same safety equipment. That's not what I or your book's saying. But it's saying that if you don't have an airport anywhere near you, then you shouldn't design any of your programs to deal with airports. And you should have data on your personnel and your safety equipment. Can we get statistics from there? Can we tell that if a firefighter is injured and we look at their safety equipment, we find out that we haven't had it checked in years, much less on a weekly basis? We have to determine the local safety and health problem. What do we have here? And we have to also compare it to a larger population, and more so, you want to compare it to other departments that have a population of your same size. So if your population's 250,000, compare your injuries and your fires to a department that has 250,000 people. There's several organizations out there that gather national data. There's the National Fire Protection Association. They do gather some data, but it'd be specifically on each topic. The United States Fire Administration, all of our fire reports go to them, and they do statistics on that. Now what you have to remember though, that NFIRS, which is the next line down, which goes to them, only covers fires. It does not cover medicals. So if, quite often we have firefighters injured on medicals because we're lifting sometimes really heavy patients, or we're lifting the wrong way. And part of our health program should include lifting methods. There's the International Association of Firefighters, the IAFF, and they were one of the ones that pushed for the 16 life safety standards. They only represent paid firefighters in the United States and Canada. Even though many of the departments in the United States might be volunteers, they wouldn't be covered there. There's the Occupational Safety and Health Administration, and more so in our state, we have the California Occupational Safety and Health Administration, which is referred to as Cal-OSHA, and they set rules for employee safety. And then you have the National Institute of Occupational Safety Health, and they're basically a testing organization. They're going to test this equipment to see how it works. They do tests. Right now they're working on tests on high-rise firefighting. They're working on tests on firefighting tactics. This is a testing organization. The NFPA Firefighter Injury Report. They do reports on injuries by type of duty, the nature of injuries, Fireground injuries by cause, falls or strains, injuries per department by population. So they have their reports, and they do the injuries per 100 firefighters, and they also do the rate of injuries per 1,000 fires. And here you can see one of the charts. You can look at it again in your book. And here is your injuries, and you can see that the majority of injuries happen on the fire ground. But what's more concerning than that is the number of injuries that occur on responding and returning to the station. We shouldn't have that many injuries. We should have very minimal amount. Look at the number of non-fire emergency injuries, the training injuries. Those three I just talked about, those numbers are way too high, and those numbers are preventable, whereas the Fireground and other on-duty injuries may not be as much. And you can see here that the nature of injuries by returning and responding to station, Fireground, non-fire, training, and other on-duty. So this is where the injuries occur. And what you can see there is that most of our Fireground injuries are strains, sprains, and muscular pains. And that's where our goal in our wellness program would be, is to try to reduce that numbers there. And you can see here again, overexertion strain has the largest Fireground number by cause. Injuries by size of population. So here they define the injuries by the size of the community you protect. So for instance, Pasadena has a population, the last time I checked, was about 144,000. So we would look in the 100,000 to 249,999 to find out that Are our injuries comparable to somebody of the same size community? If we're higher, then we need to find a reason why. And it could be as simple as we go to more fires in another community that has the same population. You have a completely different type of response districts and demographics, so you may be different. If we're lower, then we're probably doing something right, but we want to make sure that we continue doing something right. And again, here's another chart that you can look at. So what's being done? There's the Firefighter Life Safety Initiatives, which are in your book on page 17. You should review those. You should go to that website and see where the changes are being made in the fire department that you're currently employed with or one that you might be. And what this does, and they had a National Firefighter Life Safety Summit in 2004 where 200 members got together and they established goals of reducing fatality rates, producing an agenda of initiatives, create a common goal of reducing firefighter deaths, and they adopted 16 firefighter life safety initiatives, again, which is on page 17. So how can we make it a safer fire department? We have to have cultural change. We have to make sure that we don't just assume that injuries are there for the fire service and we'll just accept it. We have to have a cultural change that everybody has their PPE on. Everybody has it buttoned up. Everybody stays on air the whole time they're in an IDLH environment. We have to make people accountable, not only for themselves, but for the people that they supervise. You should have a risk management program where you're going to review these injuries and see, are we doing the right thing? Are people doing the right thing? We have to empower people to make these changes. And these changes are based on training and certification. We have to allow our personnel to go to advanced classes. We have to make sure that we give our personnel medicals every year and make sure that they're physically fit. We have to make sure that they're updated on their research agenda. We have to make sure that we're using the best technology to save and help our firefighters. There's what we call a fatality near-miss investigation. If you have a near miss, then you should investigate it and create a report. Figure out why we're having those near misses. And I've been in several near misses, and they're always on the nothing fire where something happens where it turns from a nothing fire, what we consider a nothing fire, to a fire that someone's nearly killed or killed. We have to try to find grants out there. There's a lot of grants that will provide safety equipment, training equipment, all those things. For instance, my department received a grant, I want to say it was around $7 million, and it bought a portable radio for every firefighter. So if that firefighter went down, then that firefighter could call for help right away. You have to have response policies. How are we going to respond? And it's simple things like we don't run red lights. Just because we have lights and sirens, we don't have a right to run red lights. Personnel must have their safety belts on. We have to think about when we go on a violent incident response. Do we have protective equipment? Do we have on body armor or a bulletproof vest? Psychological support. Back when I started on the fire department, in 1980, that if you went on a real bad call, you just came back to the station, you sucked it up, you didn't really talk about it, you took it home with you, and it may have bothered you for a long time. Nowadays, we have what we call critical incident stress debriefing. And we have critical incident stress debriefing teams, which are typically firefighters that start it, and then if the personnel need more help, they can go to professional personnel. And the goal is for people to get better and to be long-term employees and not have these things bother them. We have to have code enforcement and sprinkler safety. Now, most people assume that, okay, yeah, well, we have sprinklers everywhere, but we have to make sure we put them in everywhere. Are we putting them in our single-family houses? Or we put them just in high-rise buildings? Apparatus design and safety. Nowadays, our apparatus are designed and they're much more safer than back when I came on the fire department in 1980. Back then, we rode on the tailboard of fire engines. We usually got dressed driving down the street, and then we would put on a safety belt every now and then. And one of the firefighters that came on right after me fell from the rig and died. And that was going to a medical call. So again, there's one of those things that we talk about, that you shouldn't be injured or die going to and from an incident. And that was preventable, I believe. Okay, so what's being done? We talked about risk management a little bit. There's an acronym out there, SAFE Ops, stands for supervision, attitude, fitness, wellness, educational, organizational involvement, procedures, and standards and regulations. So supervision. We have to make sure that our supervisors are more safety aware now. And the best way that I could do it before I left the fire department is, as a training chief, we developed a captain's academy. And this was for prospective captains. And we stressed to them there that what they have to do about safety, what they have to do about accountability, and how they have to handle taking care of their personnel. Attitude is the key to success to any safety program. And I talked about it earlier. People have to have that mindset. It doesn't mean that you're, okay, I'm not going to go in a burning structure because it's dangerous. No, but you're going to make sure you have your safety equipment on. You're going to make sure that all your SOPs are being followed. And so you have to have an attitude with everybody. Talked about fitness and wellness. Talked about critical incident stress debriefing before. Education I talked about. Again, we provide programs to our personnel. Organizational involvement. I talked about having employees-based safety and health committees, fitness committees, labor management relationships. Procedures, you have to have standard operating procedures. Now, standard operating procedures, standard operating guidelines, it doesn't mean that if you have to do this all the time. It means here's the best practices. And that's the difference between a regulation is that a procedure or a guideline is the best practices. This is what you should do most of the time. But emergency situations are a fluid, different type of incident every time. Standards and regulations, you should be following NFPA. You better be following Cal OSHA or OSHA. And one of the most controversial ones lately was that they made all firefighters, now they didn't make all firefighters, they made all personnel who are on federal highways, you have to wear a safety vest. That means you'll see nowadays, and it's pretty common nowadays, but 3 or 4 years ago whenever this came up, it was like, we can't wear that, we're safety workers. Nowadays, you'll see firefighters all the time now, they have safety vests. And you know what, I've noticed driving around, you can see them a lot better. So, again, that was something that the fire service, the public works, police departments were forced into, but I think it's improved our visibility. It'd be nothing worse than being on a traffic accident and getting run over by a car because they didn't see. So is it working? Unfortunately, the rate of illness, injuries, and fatalities are constant. We're still losing about 100 firefighters a year. But again, we must keep striving to do that. We must continue and expand our programs. And hopefully with these efforts, we can lower the statistics. There's always new programs being developed frequently and trying to increase our preparedness and trying to minimize the potential for injuries and deaths. So in a summary, occupational safety and health emphasis is relatively new for the emergency services providers. I don't know if I consider it new anymore. I'd say that it's been there now for at least 30 years, so or at least 20, we'll call that. We really can't call that new. With good risk management, the frequency and severity of injuries could be reduced. We know that. Better programs, research data, and organizational commitment to improvement is still needed, of course. And remember that we still have those 16 firefighter life safety initiatives out there.